Hi, I'm Raj Mukherjee. I'm a consultant hepatologist, a liver specialist, and an academic in the Department of Medicine. Liver disease accounts for about the fifth cause of mortality in Europe, and about 170,000 patients die each year from liver disease. Unlike many other diseases, the incidence of liver disease is rising. When patients deteriorate, they come into hospital, and each of those admissions tends to cost around £20,000 by the severity of their deterioration, where they require lots of organ support. One indicator of deterioration in liver function is the development of jaundice. That is the yellow coloration of skin in the eyes, which at the moment we have crude measures for, either looking at it clinically or through blood tests. It would be very useful to be able to measure this in the community, ideally before a patient deteriorates, so we can actually pick up an early sign of deterioration and intervene early when the costs are low and the requirement for hospitalization is negated. Similar things occur when one looks at perfusion and changes in perfusion, which are again quite deranged in liver disease. I'd like to now hand you over to my colleague Terence Leung, who's going to talk you through the technical aspects of this project.
Hi, my name is Terence Leung. I am a senior lecturer in the Department of Medical Physics and Biomedical Engineering. So as Raj just described the problem to us, so we want to create a home monitoring system based on low-cost digital camera and processing units in order to capture two features from the liver patients. The first one is jaundice. Raj just mentioned that jaundice patients have yellowness in the skin. So in this technique, we want to use a digital camera and also a tailor-made illuminator to capture the color of the sclera of the patient. Now the sclera is actually the white part of the eye. This is the part of the human body which is independent of skin pigment, so we can capture the yellowness of jaundice more accurately. And the second feature that we are going to focus on in the first instance is the skin perfusion. So in this technique, we're going to film the skin for, let's say, 15 to 30 seconds, and then we're going to analyze the video frame by frame, and then we can capture the subtle color change of the skin over time. The subtle color change of the skin is caused by the arterial pulsation. So if we know that a certain part of the skin have lower pulsatility, we know that the perfusion is lower in that part. So by using these two features, we hope that we can monitor a liver patient at home and then provide early diagnosis.
This project marries the two strengths of clinical sciences and engineering at UCL and has already got some traction based on prior findings using this technique from Dr. Leung's lab in patients with jaundice. The strengths here clinically are having a transplant unit where patients are available, married with both the engineering setup and laboratory setup to support the project.